Trustees Platte County Health Center meeting, regular session 6 p.m. Saturday, September 19th, 2024. Let's do meeting opening and roll call, starting with Kim.
Here.
Susan.
Here.
Jeff Kingsley here. Zach. Here. Is Dr. Chatbay online?
Not yet.
Did we text? Do you want me to text him, let him know?
I will.
He's kind of probably enjoying life right now. Okay. Do we have any special guests? I don't see any. Okay, let's stand and do the Pledge of Allegiance. Okay, Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice.
Okay, so do we need to do minutes yet, or you want to wait for that later, or when do you want to do it?
You can. We have a quorum, so you can go ahead.
Okay.
And do it.
Okay. The meeting minutes for what is it? That was from August 15th. Anybody have any updates or changes or anything they want to do with those? You're good. Zach's good.
I'm good.
You're good. We have a motion to accept minutes then.
I move that we accept the minutes of August 15th, 2024.
We have a second.
I second.
Any discussion? Let's do a roll call vote. Kim?
Yes.
Susan?
Yes.
Me? Yes. Zach? Yes. Okay. Still no Chef A. Okay. Let's see, Andrew, if you want to run it, I guess go for it at this point, right?
Okay. So first thing is update on Slope Family Healthcare. I think every time we met, they kind of pushed the date back, but I think we're done doing it because October 1st is still the date. So the technology, their own fiber line is run into the building. I don't know if you saw all the holes. It looks like some big gophers or moles have been out in the yard. There's even holes in the street, but it is hooked up. Slope is coming tomorrow, I believe, to install some switches and server, their own stuff. So they will be totally separate from us. I don't know, Dr. Kingsley, had you asked me about that? I don't know.
That they're getting separate services?
Yes.
Yeah,
So,
they specifically wanted it that way. That's what you told me.
right.
So, yeah.
So they are not going to be touching our stuff at all, and we won't be touching theirs. The only exception to that is any guest into the building will be using the public Wi-Fi that's on all these signs. There's really no need for them to have a guest network broadcasting, so we'll be pretty separate. There was a little bit of confusion in one of the meetings, which they're doing all this and it's pretty expensive to do it. And then at the last meeting, they're like, so you'll be able to get into our stuff? And like, no, I thought so we clarified that. I guess they had forgotten or something, but the meetings have been going good.
When they brought up that, were they worried that we would get access to their stuff, or they were just curious if we were going to use their stuff?
It wasn't that they were concerned with us. They were asking what access we needed. And I'm like, oh, I thought we had decided we would be not having access.
Yeah.
And that's kind of where we wanted to be too. They did get back with us on some signage, so we are going to be putting that out for RFP. It was actually almost exactly like the mock-up I'd originally given them, quick and dirty. So it was kind of interesting that they had, I think if you scroll down, you can see the rough mock-up of what it was.
And where specifically on the buildings do you want to put it?
It's going to be out on Ambassador. So
the road sign.
Right.
And then you want it on the building here too, right?
No, it's just going to be right there. That monument sign that should be on that screen.
I thought they wanted us to do both. Okay.
And it just says that they are happy with that, and then some signage inside, and I'm good with that.
Okay.
So if that changes, we may do something else, but as long as they're happy with this here, and it says primary care services provided by Slope Health at the bottom, their only concern was, will it get hit by the mowers, and we'll make sure it's on a concrete pad and raise it up a little bit. and they wanted to make sure it was lit. We'll be making sure that happens. So it should be just fine. And if we end up having someone else at some later date coming in, it'll be fairly easy and inexpensive to switch it out.
Make sure we also contact Apple Maps and Google Maps to make sure they both have the health department and smoke on the same address or same street corner, whatever you want to call it.
Dustin, will you take care of that?
Remember, was it Google Maps had us, but Apple didn't, or vice versa? Just to make sure that, I mean, that's probably more their issue than our issue, but we can at least expedite that.
Yeah. And I think the only other thing that I would like all the board members to know and get on your calendar, that's not finalized, but on October 30th, they are doing ribbon cutting and opening of their clinic. So October 30th, 4:30 to 6:30 is what I believe is the tentative schedule. Justin,
Yes,
is that right?
4:30 to 6:30 on October 30th.
Okay.
So if we can, if you are available, they'd love to have you. They're kind of in charge of it, but if there's anyone we want to invite, we can certainly do that.
4:30, 6:30, you said?
Just a little bit of an update about the data migration. I think we talked about that before, right?
Sure.
They've decided not to do it. Oracle has been really slow to respond. And for them to even do it at this point, it would be next year before they were finished. And I think it's for like 80 some names. So it really makes no sense to do it. It's just, Dustin and I have kind of worked out how to package the files for each person. It'll have, all the PDFs of all the notes and everything. It'll have an electronic file if they want it. They didn't seem to want to try to import it in. So that's fine.
So they'll take their own data processors and put it into their stuff.
They'll type it.
So what's going to happen to the actual files that Cerner has once we switch over? It's just,
We keep them as long as we have Cerner, which we will have Cerner for a while.
Right.
And we will have access to everything in Cerner for the 7 years that we're required to keep the records. So that's not a problem if that's what you're asking.
well, do we have to pay to keep that service for 7 years?
We're going to be continuing to use Cerner anyway for right now. So we're not paying anything extra. We hope to switch. And once that happens, Cindy, we don't have to keep paying what we're paying. I think we get kind of PDF access to everything.
And then just delete and it goes away?
We're basically, Cindy will be here for sure for 7 years, right? But we will,
20 years.
it's not automated, I don't believe, but we will know that we need to purge those files after. There's some real liability on keeping stuff longer than you have to keep it. So as soon as we can get rid of it and legally say we no longer have that record and we met our obligation, that's always better.
Okay.
So
Right. Did you text Dr. Champagne, by the way?
I did,
I'll text him again.
and I gave him the link. And I think that's really all. Do you have anything to add? So
I know they're working on letters that we're sending on behalf of them to our patients. I think they're waiting for finalized approval from Dr. Jamal. I think they just got their official phone number and their official fax number and a QR code on there so people can scan that and be able to get access to those links. They're hoping to have that to us early next week and approved and everything, so we can start getting those sent out to everyone. Be ready for them before opening day.
Okay.
Dr. Champagne is not joining us.
Okay. How was scuba diving?
He's on another meeting.
Is it the additional?
No, he's on another meeting. He's on another meeting.
Not a meeting.
Okay, so that's all. Any questions about slopes before we move on? So the HVAC update, you all never got a call or an email or nothing from me about an emergency
Yeah.
meeting?
I kept checking.
And it wasn't because I wasn't trying, because I had called them that next week and I said, you know, I need to give 24 hours notice. We had said we'd have something by Thursday, or you all had said you'd have something by Thursday. Ends up Brian Cassell is working on a different plan instead of, same result, but instead of running all new heating elements using the emergency heat elements that are in there, he's been renegotiating with Train for them to sign on for this mechanism. And the real advantage is it's probably going to save anywhere between $15,000 to $20,000 if we can use the emergency heating coils that are in there already. And it basically just looks like the coil in your oven, except it has a lot more coil to it. My only concern about it is, and he says it shouldn't have any impact, and I want a little more than shouldn't. But if we're using this emergency heat coil all the time throughout the summer and using it much more than, because emergency heat only really comes on like under probably 15 degrees or 20 degrees, are we going to wear out our heating elements faster? That's my concern. He's not very concerned about it, but before we finalize that, I'm going to try to nail him down.
By the time there'd be an issue, he's long gone anyway, so it's no hair off his back, right? So,
Well,
yeah,
that's my concern is, you know, are we saving money on the front end for bigger expenses on the back end? And I'm not interested in doing that.
No.
So, any questions about that? That's really, I will say our humidity, and you may not be able to tell throughout the building, is a lot better with the dehumidifiers running.
Oh, good.
Nothing right. I checked earlier this afternoon, nothing's over 60%. There's rooms that are in the 30s and 40s. So,
and this is your guys' dehumidifiers, right, that you have placed around?
Are they gonna bring us like a new proposal with like, here's heating elements and this is if you use the emergency stuff and all that?
so we will see. So they will bring a new contractor proposal request. And I don't know, Jack, if you've been around to have seen any, because I don't think we've done any. We used to do, when they were actively building, we had quite a few. I don't believe have had any for months and months and months. I want to go through Straub just so we can hold their feet to the fire on all of this as a package, but you will get the whole outline of what's happening.
And any warranties or anything that we'll have, if that's possible.
Right.
Because I don't want to do all this and then springtime rolls around and it's getting the summer and, oh, it doesn't work anymore. Sorry.
Yeah, as far as I'm concerned, they should warrant it for 12 months from installation.
Exactly. Yep.
And they have been pretty easy to deal with on that part. So I don't think we'll have any problem.
Got
it. The next thing on the agenda, any questions before we move on? The next thing on the agenda is the Bon Santé is next month on board meeting night. We had talked about moving the meeting up. It does start at 5:30. So that will be kind of it'll be tight if we try to have the meeting at 4. Is there any possibility of doing it at 3? And I know, Kim, it's really hard for you. I'm sorry. One of the things I know we have on the agenda is we have an intern currently that is working on our salary study, and finance committee will be reviewing it next month.
Okay.
But her presentation will be at least 20 minutes. And if we have questions, it might go a little longer.
This is Elijah you're talking about. So
Huh?
this is Elijah you're talking about? Who are we talking about?
Maggie,
Maggie,
Maggie.
oh, okay, got it.
I mean, I could work out 3 o'clock, but Zach's probably in the same situation.
I'm on leave.
Oh,
Yeah,
well,
so
okay.
He's a daddy, by the way.
I'm good. I'm
Oh.
good for a few.
Oh, okay. Congratulations. Congrats.
Thank you.
Is this your first?
Fifth.
Oh,
Oh,
excuse me. Goodness. Okay.
2 weeks ago.
I need to get to know you a little better.
yeah, not a rookie anymore.
You're not a rookie, yeah. They're on autopilot.
Yeah, they're pretty much raising themselves at this point, right?
No, your older
The
one,
older
your oldest
yeah.
child is raising them.
They're on their own at this point. You got somebody else to focus on now. But yeah, I can, the 17th, anytime works for me.
So you want to do it actually at Argosy, right? Can we get like a little meeting room or something?
Or we're gonna do it here.
I was thinking do it here
Here.
just because of the technology.
Okay,
Yeah.
so do it here, and then everybody hightails it over to Argosy.
Yeah. So if we did 3:30, I think we can be done for sure in an hour and a half and not have to break any sound barriers getting there.
Well, you asked me if I was gonna be there. I have that meeting that Dr. Sheffay's at that day. What you guys were talking about. I won't be able to make it, what I'm saying.
So you won't be at
I
Farm
can't go to that, yeah. I'll have to call.
Aren't you the one who said you wanted to go?
I did want to go, but then my wife told me I had a meeting to go to.
Okay. So the boss rules.
Yes.
Are we still, we already have the tables and everything, so is the other 3 board members,
Yeah.
you're all good?
Yes, yeah.
Yep. And I'll call in.
Okay,
You'll have your quorum. It's just, I won't be there in person.
okay.
3 o'clock or 3:30, what did you say?
What can you do?
I can do 3.
Okay.
I'll just have to take, I'll take leave.
I'm so sorry. We'll try to minimize this, but if we could do.
It's
3
fine. I'm just so,
It's for a good time.
as usual, I'm overprotective of my time.
Yeah, if we can do 3, that might be better, just so
Okay.
we're not too crazy rush.
Okay,
You'll like the food, believe me, it's well worth the time.
So Cindy Cogan, please make sure next month's meeting is scheduled for 3 p.m. So I will go ahead and talk. So the next thing is actually my report, which I've already covered several of the topics. But this will be the last family health care clinic that we ran report. Dustin is working with Slope so we can get numbers, at least preferably monthly is what we've asked for. I don't think they have any issue with it. They just haven't worked out their workflows yet. So we may not see it next month, but they know we want it. And I would just like to see the traffic flow, what they're seeing. So far, they have had
18 MRs for
18 of our patients go to them. So not the highest number, but if you look at last month or in August, we had 18 people here. They had 18 people roughly go to them in the past month. So people are going. And so that's a good thing. Go ahead and scroll back. Keep going. The last thing really is the budget. We are at the end of August, 2/3 of the way through the year. We have 84.1% of the revenue and our expenditures have been 60.4%. So we're right on target. We are going to finish almost exactly where we're supposed to be. One of the things we did do just a week or 2 ago, well, I think I said I was going to do it the day finance committee met, and you saw that Michelle had done it. We actually populated our 2 reserve accounts with our first installment, which was 1% in each of our total budget. So do you remember how much that was? So about $80,000 roughly
Per account.
I believe it was 40 something in each one.
Okay.
And then in
I don't know if I
November,
saw that.
what's
Is
that?
it in here?
Ah.
Okay.
We talked about it at the finance.
Yes, that you guys were gonna get together and,
And it's
Okay.
been done.
oh, okay,
So
okay.
we
I see
have
what you're
money
saying.
in those accounts.
Okay, awesome.
Now, in November, we will be, that's the second infusion according to the finance or the reserve account
Okay,
policy. We look at where we are, there's a minimum number and I forget what it is, but whatever we're in excess of that minimum number is going
Will go
split
in there.
equally into the reserve accounts.
Yeah.
So, and then in January, we will put next year's budget, 2%, 1% in each one. So we will have at least $100,000 in each of them in January, which will be nice. If we ever do have to do a building, we're going to have good money in there.
We're not doing.
Dr. Kingsley
Yeah.
says we'll never do a building.
We're here for a long time.
But if we do have repairs or whatever, we're going to have that nest egg there.
Right.
And it's gonna be a very accountable thing.
So going to the expenditure, so we're 66% at the end of August. We're 60% of the total. Do we anticipate any major expenditures, whatever, that will be a problem or anything for the rest of the year?
Nothing major. We will have the HVAC bill that was unexpected.
Right.
But that won't make us go over. We are going to, I don't anticipate getting in the red in the budget. We've had some staff, well, actually, I know we won't be in the red. Simply because we lost positions in family health care. So we did have to pay them out, their vacation and stuff, but we're not paying them. And in fact, later in the meeting, I'm asking for a couple positions into the table of organization. And it's not going to, it's kind of just shifting. The family health care clinic costs a lot of money. So, go ahead. Dan is not here, so I will just let you read through his report. He's not feeling very well.
Is that a me?
He said if we had any questions he had to ask, we can ask him, but Dustin said he sounded like that, so.
He was doing fine last night. That's interesting.
Dustin, you
Sometimes
want to?
We're all at the.
Sometimes it's.
That's what I'm saying. I wonder if it was the pasta we had to ask. It had to be something pretty quick like that.
Yeah, I don't know.
But he was sick before, a couple weeks ago, so I don't know if he sounded. Yeah, okay.
He sounded fine yesterday. I said, and I spoke to him earlier because of our excitement earlier. I want to make sure that he was out of the building on his way home.
Blown up too.
Yeah, so I called checking on him, and yeah, he definitely sounded sick. So Dan, I know you're listening. If you were faking it, you deserve an Oscar. So that was like your award for we recognize you with on Wednesday.
So they're basically, just so everybody knows, there was a conference, a public health conference in Columbia that was Tuesday through today. And Dan was there. We were all there. Susan was there too. And there was a bomb threat. So they had to shut the whole thing down. I was in the shower when you texted
Today.
it this morning. Yeah.
Yesterday was fine. Oh my God.
So we were all together and we went out to dinner and he was totally fine. But we all went to the same restaurant. So I'm wondering if he had pasta. So maybe it was bad.
Well, he said that he sounded, so I'm thinking maybe that respiratory thing came back, because he
Well,
had that a couple weeks ago.
but a bomb threat. That's how bad that conference was. They had to get rid of it. And shut it down.
How was your round table?
I didn't get a chance to do it.
Oh, you didn't do it?
No, I was told I was in the shower. I was going to get my suit on. I was getting ready to go. And then
So
there you go.
there is my goofy smile and Dan getting his award.
Yeah.
And there was a good turnout when he got his award. There's probably over 300 people in the room. So,
It was very nice.
So what was the actual award so everybody knows?
the W. Scott Johnson Award from the Missouri Public Health Association. And Dan and one other person won it. It was the first time in 73 years that two people had won it in the same year. But the other person was Stephanie Browning, who's the director of the Columbia Boone County Health Department. And she is retiring next month. Dan is retiring in roughly, he says June now. It keeps creeping closer and closer. But I think the award committee probably wanted to make sure both of them were recognized before because next year's conference, they'll both be retired. So a pretty big deal for him, I think.
Is he watching us?
He is.
Good job, Dan.
Thank you. I really appreciate the support of coworkers and that made the trip to be there. Wrote letters of support. Really appreciate Andrew for nominating me, and it's really cool to have a couple of board members there. That's a first for me in 33 years, and really appreciate it's kind of nice to have finish the home stretch here of my career with a very supportive board of trustees. So thank you.
Thank you for all you do.
Thank you.
So I don't know how I feel about this whole sympathy card you're trying to play though. You already got recognized yesterday.
Picked up
Yeah.
somebody.
We used to call that
I
the,
woke up in the middle of the night and I was just drenched, and I think it must be the flu. Body aches, headache, fever, chills, but nothing about me.
Feel better.
Good job, Dan.
Thank you.
Dexter.
Going to my report, so we did some lead training, contacted Carla with me just for our case management. Luckily, Pike County doesn't have a ton of lead like most of mid and southern Missouri does. We learned a lot of information there, got some really great resources. We went through our back to school season pretty successfully. Kept us pretty busy. I think the biggest highlight we had was our TB investigation. So I think last month, Andrew and I mentioned that the CDC was kind of going around and investigating this, helping with these pockets of the Micronesian population and providing education. So we were really blown away by how that event all went transpired. Like we went there, came back a week later to provide the testing. They anticipated probably about up to 50 people maximum that attended that church that was going to be in attendance. And you saw there, we did 129 tests. Word just got out. They had friends, family who worked elsewhere who heard about it, came there. And it was just a really great experience. Seeing the whole entire team work together. Like Taylor was over using the church copier, trying to make more copies for paperwork so we get more people in there. We ended up calling Dan. He came in here, got us more supplies. We were about out of syringes, so we called our partners at St. Luke's. They gave us a box just to kind of help us get through and get all these people tested. And we returned on Friday that following those following few days, and then 116 of them ended up coming back for it, which we were really, really grateful for that. It was not nice to get. They'll see a little reaction, they'll freak out and not come back. So we were glad that a lot of them did return. And we've seen quite a few of them coming into the clinic who weren't able to either return that first night or weren't able to make it to the test initially. So it's everything's been going really well with that.
so there were 10 total positive skin tests. So what's the plan with the 10?
So most of those are in Kansas City health jurisdiction. So we referred to them there. We gave them like all the paperwork and information regarding them. And we have 2 in our jurisdiction. So we've already reaching out, getting them like their chest x-rays, working on getting them set their medication.
So I do want to point out, and you can probably do the math, but 116 out of 129 coming back is 90%.
Awesome.
And that is almost unheard of.
Yeah. I was
In
gonna say.
a setting like that. And we've got no shortage of attaboys from the state health department. They could not believe that we were so successful. This group of people has historically not been super compliant previously so far in this effort, particularly on the Kansas side. And so they were just super impressed. They were blown away, and they said, what did you guys do? And we basically just said, we made sure we took it to them. Now it did help that we had that meeting and CDC was there and all their authority type figures were telling folks how important it was. But, making, I think some of the other jurisdictions make them come to the clinic during business hours, and people drop off very quickly when they have to go out of their way. And we took it to them, and staff did a great job. So very, very impressed. One other thing, and I think I told Dr. Kingsley this, but I got a call from the state health department again, and KBHE has one of their TB patients on the Kansas side that was non-compliant with active TB. They were meeting people here at a rest stop in Platte County to go up to Iowa to visit family or for some event or something. So they asked if we would have law enforcement go to the rest stop and stand by while KBHE handed the person their isolation order and have them go back home. Never know how stuff like that is going to turn out. And so I do really want to, I had called Major Eric Holland and asked him if he could send someone out. He said, my people are kind of spread out up there. I have 2 people that are headed that way. And of course, they gave me like 5 minutes notice about this. But he also sent the highway patrol. So law enforcement, the sheriff's department and Major Holland were great partners. And so I just want to recognize that. And we looked really good because, oh, you got them going? That's awesome. And I'm like, well, we got them and you're with the state health department. So you probably could have called the highway patrol too, but that's fine. We'll coordinate.
Yeah.
And so it all worked out. And the person, my understanding, just voluntarily went back. So I'm not sure.
Probably because they didn't want to expose all his friends. That would have kind of stopped.
Well, they
Already
knew.
knew.
So I don't know what the motivation was. They knew they were active TB.
Okay.
So I'm not sure, Dr.
Maybe
Kingsley.
just the presence of police. I don't know.
But they would have went home and spread, or to Des Moines or wherever they were heading and spread it to their
Right.
friends. That would have been good.
Right.
So the 13 that didn't come back, are they going to their houses to find them and get tested? Because why would you get the thing and never have it checked the second day, third day later?
Some of them actually end up kind of town, like they had like flights previously. They weren't thinking about like returning on those days when they initially got their test. And a few others just got caught up with work and weren't able to make it back in time. So which like that's why we kind of offer that, to come to our department. We'll make sure that you come in, just say you're part of this investigation. We'll make sure you get that free treatment, free testing, treatment, all that. We'll make sure we get you taken care of, just like we did everyone else. So we've had a few been scheduling and coming in and doing that.
So the next question then is, in Micronesia, did they do BCG vaccines?
They do.
So did they all have it too?
Not everyone. Some people have had. A lot of them have been born in the U.S. Sometimes they're born in the U.S. and they end up going back in like in childhood and then end up moving back. I don't have a total of how many people had BCG vaccine.
Because they'll be positive, but you need to have something from the past to compare it to and see if it's the same. You guys, it prevents you from getting tuberculosis
I
and
kind of forgot
meningitis.
about that. but it's like,
Yeah.
yes.
So you'll have a positive, right? But so the only way you can get past that is just have previous ones that you know the exact centimeter diameter, and then just compare it, make it the same. You still have to do chest X-rays.
Yeah, we do. We would.
But so those 10 that are positive, just maybe BCG positive.
There's a few that did have BCG vaccine historically. Most of those were though. I think there were 2 who were children who were in the Kansas City, so those likely were probably false positives because they were very, very minor for their duration. I think they were like just 8 millimeters, but since it was the way CDC and state had kind of wanted us to go with this investigation, but it was a contact-based investigation, so that anyone who was 5 millimeters or plus was automatically going to be flagged positive, whether they're born outside the U.S. or not, or had any different health issues, which makes it a lot more likely that you're positive for some people. So,
And did they say contact based? I thought it was something like group
It was like a population-based
Yeah,
one, but
population
they,
based. They had some different criteria
yeah,
they wanted us to follow for.
but they
They
wanted to
wanted-
consider that they were all kind of contacts exposed to a positive active case at some point, so that's why we had to go with.
The other thing they have to be aware of is if they leave and go back to Micronesia to visit their family, if you're there for more than a week, you're automatically assumed positive or been exposed or whatever. So they have to know that too. I'm not saying don't go back to visit your family, but just be aware that you're gonna have to go through this whole rigmarole when you come back. So I'm assuming they don't go back for less than a week. That was silly to go that far. You're gonna be there for a couple of weeks, if not a month.
For months.
Yeah, I mean, like I said, Anchor said, it was a really great experience. Everyone worked really well together, very proud of our staff. I mean, it was in the middle back to school, so a lot of those people were working like 12, 14 hours that day. Just,
Of
it
course
was a-
they happen. That's when they happen.
Yep. So, but yeah, it was a really great example of public health and like, it reminded me of some of our best days of COVID, whenever you used to have everyone coming together doing something really big and important. It reminded me of that, and makes you really proud to be in public health. So, it was a great experience, and like we had a lot of support from their pasture, and a lot of things they've been teaching a lot, and all these different conferences we've gone to is get with your congregations, like they're your religious leaders. They're the ones who speak to a lot of people. They trust them. Like they're your greatest assets and partners to have out there. So, does anyone have any other questions about my report?
I'd say the only kind of pickup is I think when you were doing the skin test, we should have been wearing PPE and we weren't, right?
Yeah, I think we initially we arrived there. There was only like a dozen children, and we're like, "Oh, this could be a bus. No one's gonna be coming in here." So we didn't have our PPE on, and then shortly it got very busy very quickly.
But then when we read them, we did it outside, so it wasn't required. And it happened to be a beautiful,
It was a
cool
very
day.
nice day.
And our intern got to see that in action, and she worked with me at the table checking people in. And the names were just amazingly hard.
Yes,
So
yes, they are.
it was very fun to blame her for all the bad names.
But yeah, I think that's something I have. Unless anyone has any questions.
You're up, Taylor.
Can't scroll and talk at the same time. No. So
Would you go ahead and mention the TB clinic and the survey? So we're doing a community health assessment, and we took cards for filling out the survey online, and we took them to the TB reading event, and it was kind of funny. She's like, I got all these new surveys done on Friday night, like at 8:30. And she had no idea, like, did we go do an event? Like, did we give out cards?
well, no, I knew.
Or did you know
I
that
knew
it
what it,
was?
yeah. I mean, I was like, I was wondering if there was any other events because
Oh, okay.
because like you said, my intern like took the stuff because like it was kind of last minute when we went and did the original ones. We didn't expect that many people to show up, and so we didn't bring the survey. But then when we went back to check, it was like, oh, that was a lot of people. Like, and they actually spoke a lot more English than we expected to. So we have, yeah. So like he mentioned, we're in the middle of this community health assessment, and one of the parts of that is that community survey, which right now we have it in English and Spanish, and we're getting it translated into Arabic and Vietnamese, I believe. And I don't think that we're getting it translated into Chuukese. It's very hard language to find and very expensive.
Is that the Micronesian language?
That was the language.
Does Marty cover that though? The little translations?
Carol Amen, kinda. So since it's a rare language, you have to call and schedule when you're gonna be using it, have it as an appointment set up. So they do have access to some of those more rare languages, but that's.
When they came, did they have their own interpreters with them?
I mean, most of them spoke like pretty good English, is what we found.
Some
A few of
spoke
them,
better English than me, which mine's not that great, so that's not too hard. But yeah, some of them you wouldn't even know.
right. So
So
I
there,
think we were pretty
and the
surprised.
advantage of that group is the pastor was there, so whenever we had issues, they were right there to help. Who,
had a very trustworthy person there.
Yeah. who translated the Spanish?
At that event,
No, for the
for
question.
the survey, it was through JBS,
Okay,
the Jewish
not
Professional
you.
Services. No, I offered.
She speaks
Taylor,
Spanish.
Taylor actually
Speaks
speaks
Spanish.
fluent Spanish. And when we worked together at Cass County during COVID, and we had several things that we needed translated and put into writing, and Taylor did all that. So that's just always been something I've always been impressed by, because I can barely say taco. He can take the whole pages and do it very quickly, and apparently a lot of the syntax and stuff, you have to know what you're doing when you put it into print. Taylor's very good at that.
She does show off when you go to like Mexican restaurants.
El Oso.
Today is that what you're
Oso is ox, right? What is Oso?
Also is bear.
Bear. Okay.
Yeah.
That was close. It was an animal.
Yeah, so we're in the middle of this survey, trying to push that out to the community. And then we're also planning community health forums. So we have a few of those coming up at the end of September and early October. And actually, now that I think of it, is that something that we could share with you guys? You could send out to your networks, either the community surveys. I mean, even if you wanted to fill them out, that would be great because you live in the community. So we do it as part of the Northland Health Alliance, and I mean, Clay County has a lot more people than we do, but they are currently beating us in their numbers, which I guess they have 2.5 times the population. But we've been trying to get it out to lots of
Yeah,
communities,
we'll send
but
it
if
to-
that's possible, I'd like to.
Yeah, we'll
Yeah,
send it.
What is our goal population number that we're shooting for? What's our?
I think it's.
There's
Well,
So it's
110,000 people in Platte County, so
But it's a representative sample, so it's,
like 1,000.
yeah, it's around 1,000.
1,000. Yeah.
we are at about 800 right
So
now,
200 more.
so.
Okay,
uh,
that's
But
doable.
it's getting the right population. So I think, honestly, I think we have focused on, kind of the lower socioeconomic, and that is actually what we've got a lot of. So we actually need to spread out the responses and make sure we get a representative sample. And they will go through and do that.
What are the questions that they ask on the survey?
So I mean, it's like about close to 40 questions. I mean, some of it's just demographic information. It's just asking questions about the health of the community. If they have difficulties getting to doctor's appointments, what challenges are in the community, what the biggest strengths are, and different things like that.
So I will warn you that it's a very long survey and lots of words.
Mhm.
And you may look at that and think, wow, why would we ever send out this long survey that's so complicated? Taylor and I adamantly opposed the survey because it really didn't have good health literacy in our opinion. And it was too long.
Mm.
But we do this with a whole group of people and we lost. We got outvoted. We got voted off the island, I think.
Some of the things they listened to, but I think that it was just, there's so many different parties in the Northland Health Alliance. So it's a bunch of hospitals with suggestions, and then we're also like have iBoswell, who's the consultant agency that's helping, and they have their own opinions, and it just, I mean, it is a little bit wordy, and
So
I
it
wish
takes
was a
what,
little bit
15
more
minutes to
concise.
do, or how long does it take?
Yeah, I would say like 10 to 15 minutes. Like, depends. There is some like skip logic and stuff in it, depending on how you answer.
These school districts, depend like their newsletters.
Rebecca did. She was going to. Yeah, so then we're gonna be doing those forums coming up. We're gonna do one in Riverside on September 26th. Then there's gonna be one on October 1st in Excelsior Springs. And then October 9th. I think that location is still to be determined. And then another one on October 19th. And then there's gonna be a fifth one that Children's Mercy is mainly putting on, but it's gonna be focused towards children and doing a forum with children as well. So that'll be added into our data collection as well. So taking up a lot of time right now.
Mhm.
Is anybody going to Third Friday?
What, what?
You're going to Third Friday?
Oh, I don't
I
know.
said you could bring a bunch of those and grab.
Yeah, that's true.
How about at the schools? You're gonna get school and grab a bunch of teachers there?
I can find something to do.
Because you just need 200. That's doable. If everybody just
Yeah,
try to shoot for, 10, 15 each or something. They can.
I mean, I
That'd be
can
great.
hand some out. Yeah, yeah.
Yeah, and we do have paper copies too, so there's an electronic version and a paper version, but we also have some like flyers and stuff with QR codes, which you can grab some of those.
You
And
know-
give them to you or email them to you.
No,
I mean, I can get,
I frequent many establishments that people have. I'm sure I could put that out like.
Do you want it random or we just grab people?
Yeah, just random, whoever you just hand it out.
Because then
I
it won't be an
limit
effective
so my
sample.
neighbors, I could do.
Yeah,
Well,
yeah.
we've already got a lot of people in, so I think,
I mean,
It's
it's supposed to
kind
be
of-
a representative sample. It
Right.
should just, I mean, you should really be considering like, for the most part, like,
I've got family.
is this a place I really want to put this out to? It should just be like, put it out to random areas. Try not to.
But I mean, let's say you decided the 200 and it was all, you just did public health people, you're probably gonna get a full skewed
Sure.
response compared to somebody from,
well,
go to the
So,
mall.
and then they
Yeah,
plan on like
that's where, like,
weighting it depending on
kids
different
daycare.
demographic information.
so there's information in the survey, but they are going to measure. So they're getting a representative sample.
Yeah,
Your-
yeah.
your
uh-huh.
income, all of that,
Right.
so it's gonna, yeah.
And then also like by zip code, so we can.
But Taylor will email everyone.
Okay.
And then when she's done with her report, I can run the computer if you want to go get.
So
the
when does this
paper
need to be
stuff.
done by? What's your due date?
October 20th.
And then once you have all this information, then what happens to it?
Well, then the data task force is gonna go through it and compile it, and then we're gonna take the information from the forums and the surveys, and it'll ultimately be our community health assessment, and then we'll have a few different events where we'll showcase that, and then that will highlight the next priority areas, which will turn into the community health improvement plan, and then kind of like the task forces that we're doing. So we have the 3 task forces right now. It's access to healthy foods, access to transportation, and mental and behavioral health. And so some of them might stay the same, some might change completely or change a little bit. We'll see kind of how that shakes out. But once we have those, that information ready, we will invite you as well if you want to be.
Have you guys like taken it to locations to like see if they'll hand it out, things like that? Or is it something where you've gone to events and just had paperwork with you?
So we've given it out to like the YMCA and some of the libraries. Excuse me. Uh-oh, hopefully I'm not getting sick. No.
I mean, they go to Zona Rosa.
Yeah, so we put it at the libraries, YMCA's, and then we have a bunch of events. At any of the events that we're going to, we're handing it out. I know there's like a senior fair coming up, and there's a few different other fairs and events and things, and so we're trying to take it out to those.
And make sure we go to the north side of the county. We always forget about this place.
That's one of the things we've already done.
Right. You've been up there?
You did.
Okay.
Every event that we go to up there gets the stuff for like helping
Okay.
the schools.
The health ed team is really helping us push it out because they have kind of more of those community connections and stuff.
What's that?
Finance.
Me,
Yes,
in your packet is the proposed
What page?
29 investment policy. And we decided to make this a board policy since it's something that we would be reviewing and reviewing the monies and that type of thing. And once we would approve this, then we can start looking for where we want to invest the money and put out, RFPs for that. But, I had a couple of typos on this that we had missed, because I went back about 3 or 4 times and, on page, well, it's page 34, but page 6 of the policy. That should be, under bankers acceptances. It should be 5%. It's like a 5 degrees. And I went back to the state.
Where it says no
to
more than
confirm
5,
it.
that
Yes,
5%.
yeah, that should be 5%. It's just a typo. And then and it may just be me, and you guys can, but on page 10 of the policy, or which is page 38 of the packet, up at methods, that first line, the director for the finance committee and subject to its approval, it doesn't flow for me. Would it be the director under the direction of the finance committee and subject to approval, or?
Yeah, I think that's what you're
Yeah,
trying to
the
say.
director under whatever you said the first time, I really liked it.
The director under the direction of the finance committee and subject to its approval shall prepare an investment report at least quarterly.
Or just do that at
Under
the
the
start, under the direction. and
Under the
approval
direction.
Of the finance committee,
Committee.
comma, the director shall.
The direction shall, there you go, there you go.
So just flip it around.
Did you get that? Under the direction of the finance committee, the director
And its approval.
and its approval, the director shall prepare an investment report. Yeah, that's a lot better. Thank you. And, and then methods, and then the second two. It's Government Accounting Standards Board, GASB. And then it just looks like a 3 and then a space and a 1. It's 30, I think it's 31 requirements. So I don't know if that's just, or it might be 3.1, but when I went back and looked in the state thing, it just said 31.
Okay, we'll change it to
You might-
31.
Okay. And this is taken from the state treasurers. We just modeled our policy off of that one. Yeah.
So was there any particular investment vehicle that you want us to get the RFPs from, or what?
We will put it out we'll put it out to everyone, but the company that came to see us, and I remember Angie, I forget the name,
It's most of,
we like them,
yes.
but we can't just choose them. We have to put it out for RFP. And there's at least one other company that does the same type of governmental investments.
Mhm.
So we'll put it out and see which one gives us the better terms.
Did they
While
actually
we
have,
liked her,
did they have salespeople that come and
Yes.
actually give us the spiel? I
Yeah.
mean, that might be worth having them come and give us a spiel.
I thought that's.
Oh, sure, he did with you
We
guys?
did.
Oh,
yes.
okay, I didn't know that.
Yes, that's where we got that. And then,
so I think if we pick one, we could certainly have them come speak to the whole board before we commit.
That sounds like a.
so that you
Does
guys,
that
yeah,
sound reasonable?
we won't do all that.
And what criteria do we want out of this deal? So we want the best interest rate and what else?
You know, liquidity is a big deal, best interest rate, and those were really the biggest
We had good
thing.
ones, yeah, and
And these are like
that was really-
money market accounts, or what do we actually clarify these as?
There's several
several things, and my page, I can't find it.
There's several
Oh, there it
vehicles.
is.
Yeah.
Okay.
Spreading
It
out
could be
so
CDs, it could be liquid, it could be, this is what,
And once we put this out for bid and get a vendor, if we have them come present, they'll be able to answer all these questions. I could follow it perfectly when she was sitting there
Uh-huh.
talking to us.
Uh-huh.
But now that it's been like 6
months.
weeks since she's
I
been
mean,
here,
this one paper was this, that's a good,
So are these almost like CDs where they mature after a certain
so
amount of time?
CDs is one option.
that's one option.
But that's what those are, CDs?
Well, that first, the column on the left are the CDs.
And what's the one on the right that we call it? What's it called?
Direct purchase certificates of deposit.
CD.
CDs.
So
And then,
that, two different versions of CD?
but the other thing, the further thing on the right, on the bottom is that liquidity in terms of the monies that you can get.
That's the better interest rate, looks like, huh? Well, not, these are actually.
Your time, how long you want
Right.
But
Yeah. And
even
that's-
their liquid, their one that is we could call and get the money out within
7-day
24
yield.
hours.
Yeah.
It is better than what we are currently
Sure,
getting.
I get that. Now, are we gonna be, I don't know how much we're gonna invest money-wise per CD or whatever. I guess we need to discuss that too. What are we willing to invest per CD?
So
That is the,
that is something that we will be discussing.
Jumping the gun.
Well, it's pretty much all of the reserve accounts we can put in. We just need to determine. There's no reason not to put all of it into the liquid accounts because we can get it in. I think she said
7
like,
days.
it was really quick. And we're not going to have any expenses that we can't,
Or
not
maybe
pay
overnight.
after 7 days.
So then it's better almost to do the 120-day one or whatever, the longer period ones?
So
Well, possibly, yeah, because
that's 7 day yield.
no,
That's gonna, I would assume that's fair.
that's, yes.
So it's gonna go up and down. We won't always get like 5%
And-
return.
But we will kind of, we'll have to monitor it, obviously. We can be monthly, so.
So some of that policy we can't do until we find out what the actual, what vendor we're using and what their terms are.
So that, I agree with that. I guess the way I was looking at those, if we, let's say we're putting in 40,000 at the account each month. Instead of putting that 40,000 to that account, we just do 40,000 into a CD each month and just have a whole bunch of CDs just racking up. Yep, tenure, I guess, whatever you want to call it.
You know, we'll have to look at what it makes sense fiscally too. We do have bills to pay.
Right.
So, but we know at the beginning of the year and at end and beginning, when we're getting the big tax levy checks, which is when we usually get them.
Mhm.
There's no reason not to, we're not gonna spend that money till December.
Right.
There's no reason not to have that money getting as much interest for us. So that'll be something we'll have to
Want
work
to figure out
out.
how to, is there a minimum amount of money they want us to invest with?
I believe she said no,
I don't remember.
but
No charge is set up.
All of it, yeah. But that does make sense. If we give a block chunk of money at the start of the year, once we get the tax levy money, right? And just put it in there and know full well that we're not gonna touch a lot of this money until maybe August, September, or whatever. And do whatever the 120 days or whatever the maturity thing is, 3 months maturity or whatever.
yeah, we can do that. We just need to know, we didn't do a lot of that ciphering and math because we don't know what the other companies might have
Right,
to offer.
sure. I'm just spitballing. That's all.
Yeah.
Okay, good job.
We have work to do.
So do we think it's
We have
more,
something for the agenda.
do we just think it's 2 or is there more vendors to choose from? Like how many people we're gonna be looking into besides just the
All
2?
I know of is 2, but who
Yeah.
knows when we open it up.
Yeah.
And this person, Angie, actually has been in contact. She has followed up and to see what we're doing and if we've made any decisions and stuff. So she,
So she actually also had Mike Schlegel, who's the superintendent of Braymore Peculiar School District. He called me to say he's on the board of MOSA. And so he called me and said, kind of gave me his pitch because I know him, I've worked with him. And he's like, it's a great organization and I support them fully. Obviously, I'm on their board and I'm like, well, and he knew we'd have to put it out for bid. He just wanted to give me his version. So we'll see.
Okay, when do you want to put the bids up?
I
Well, we
believe,
have to approve the policy
yes,
first.
Okay, so let's do that. So do you want to do the changes first and then,
I think you can just approve it with Susan's
With-
changes. So
Okay.
move to approve the policy with Susan's changes.
can I make a motion to approve the policy as stated with the changes?
The investment policy.
Investment
Investment
policy.
policy with addendum changes.
I second that.
Okay, any further discussion? Kim,
Yes.
Susan,
Yes.
me, yes, Zach?
Yes.
And I think that was really,
That was
that
the
took up
majority.
most of our,
That took most of it. Michelle's still working, on payroll programs. That's kind of a work in progress. And interviewing, her and Cindy are interviewing companies. And then, we'll see those reserve reports on paper next month. So we'll be able to
Cindy? Do we have any fee resolution? We do need to review and approve the bills.
You had a chance to look out?
Yes.
Anybody want to make a motion?
I move that we pay the bills for the month of September. What are we, August?
This month's bills.
This month's
so
bills.
we-
There we go.
Whatever month we're in. I move that
August
we
10th.
pay 'em.
September. Yeah. I second that.
Second, any further discussion? No. Kim,
Yes.
Susan,
Yes.
me, yes, Zach?
Yes.
Okay.
We'll get there just a second.
So there is or is not a fee resolution?
There's not. So the first item of new business is you should have in your packets a memo from me regarding a request to add 2 positions to the table of organization. One is an environmental public health supervisor and the other is a community health development specialist. One of the things we are doing with accreditation and with the state is doing foundational public health services gap analysis. And the preliminary data has come in and they say we are about 19 positions short. I think that's quite a bit overinflated. My guess is when we are all said and done, we are probably going to be about 10 to 12 positions, probably around 10.
12 to 14.
Okay.
Are they comparing us to other counties in
Sure.
particular?
Other
or-
counties in Missouri, I mean, there's a whole,
And maybe I probably should have put this in my section too. So they're doing, the whole state of Missouri is doing this like gap analysis thing, looking at the foundational public health services. And so like they have this huge thing, giant Excel document with about 15 tabs, and each tab is like, tons and tons of pages. We had to go through and look at like last year's spending and then compare it to current spending. And then they kind of calculate, they have this like calculator that tells you based on,
population.
based on
numbers,
population and
how much number of
different
services that
things.
you provide, restaurants,
like
disease
what-
reporting.
what you're missing. And so it pops out, with that, but we are kind of in the final stages of filling that out. And that should be completed by next week.
So it seems like they're very specific with 19. Are there specific job titles that we don't have or something?
So the way that they do it, they look at like the different areas. So they look at the different foundational public health areas. So like assessment and surveillance and communicable disease control, environmental health. There's a bunch of little like equity, different categories that they're.
But do we
looking at.
have those people already working? We just need to change titles? Is that what we're supposed to do? Or
We don't have, like, for environmental, we should have, according to this analysis, 6 or 7 total? We have 2
what specifically?
environmental public health specialists. and we have 2. We know that it's a problem. But one of the things in the past, not to go off on too much of a tangent, but each year, so in 2022, we put about $379,000 into the primary care clinic. That's where 379,000 of our tax levy dollars went. So we couldn't fill these other positions because we didn't have the money. Last year in 2023, we put about 544,000 into the primary care clinic to subsidize grants and things that were coming in for that service. Now that we are not having those expenses, we need to work on our foundational public health services. We did have even our preparedness planner helping with inspections to help them not get so far behind, but she was only doing it part-time and we were falling behind. The more I dug into that, the more I found out how far behind we were. At one point, maybe a year and a half ago, you'd asked about it, and it didn't look too bad. We also had that preparedness person not doing their job, doing inspections. So that is one area of critical need. The other area, and Taylor might talk about it a little bit, in the gap analysis, there is no such thing as a health educator because our health educators do about 8 of the different functions that are in the gap analysis.
Yeah, so they look at like injury prevention, communicable disease prevention and control.
Chronic disease.
There's chronic diseases. I mean, and some of it is like community partner engagement and community like equity outreach, things like that. So it just pops out, like you put in tons and tons of numbers, things based on the past or for 2023, and then it like says you're missing in this area. It doesn't say what specific positions you're like missing, but for example, I mean like environmental health, that's pretty much like one position. But like injury prevention, we don't have like an injury prevention specialist or something, but that would fall under like health education.
What exactly?
Yeah.
What is that?
Yeah, I was gonna say,
What is that? What do they do?
So, and like, you know what, and I don't know why they define it that way, but it's, a lot of it is suicide prevention, right now, but I mean, it could also be like, you know, teaching people to wear a seatbelt, wear a helmet when you ride a bike.
Our car seat check coordination.
Yeah,
Car-
do we do that now though?
We do, but we don't have, I mean,
We don't have the title for it
no, we don't have enough staff to do it.
Okay.
I mean,
for the
I don't
population.
really want to air all the dirty laundry about how we're not doing stuff, but we are short people and
Well, I
don't
just,
have enough
and here
people.
we are saying we're short people. And then just listening to at this seminar,
Yeah.
I mean, when they have one person or 2 people in their health departments and, you know, there's no way that they can meet all these,
Right,
you know, it's,
Now, I do think one thing you should keep in mind is we have 115 health departments throughout the state, local health departments. And a lot of these counties have like maybe 5,000 people total. So there's some real differences there.
that's correct.
The other part of that is, I'm not sure how we're going to get these smaller counties up to par, but you know, Dan and I have talked. Dan's big supporter of, you know, pooling those resources. They may have to, you know, share some of their health educators among,
And group, yes.
you know, so when you have more farm animals than you do people, it's kind of hard to have the resources to,
Right.
that, you know, we're very lucky. I'm kind of saying we have some shortages, and we do, but not nearly as bad, like you said, as some of these.
Well, when
other
they don't get
districts.
tax levies, I mean, and then Missouri's the 50th state, $7 per person
From the state.
from the state.
So when I
And
was
that's
at,
all they have. you
so
know.
when I was at Cass, that was the second lowest per capita public health funded.
It's the lowest now, we're
Is
50.
it? Well, I
No,
mean,
it's the Cass
You mean
County
it's Cass
itself.
County.
Oh, Cass.
in Missouri, it was second to the lowest in the state. And I
Okay.
had 13 people total to fill all the public health needs for Cass County, which is about 108,000
Yes,
people,
okay.
and 4 of them were WIC. So that was 8.
Yeah.
Or 7.
So how do you want to actually
for
proceed?
everybody else.
So I see at your last sentence is, however, it's not recommended to add any other positions at this time. That's aside from the 4.5 and the 14, or are you saying at this point?
Just
see,
I'm asking for 2 positions right now
okay,
because they're a critical need.
right, yeah. Can you told me that?
And then when we finalize this, when we go through the budget process, we need to know, I'm not interested in laying people off. I'm not interested in making recommendations that are going to overextend our finances. I am 100% confident we can add these 2 positions and cover them in the savings. But I think we need to be very strategic as we move forward, as we go through the budget for next year and look at what actually is finalized in the gap analysis. I don't agree with everything in the gap analysis because there are some things that we probably
It's not
don't
realistic.
need that.
So another thing too, let's say we hire an injury specialist, like you said, but let's say they only have enough work for 1 day a week. Like, I don't even know
Well,
what they would
that's
do.
sorry, that was not my suggestion.
But I'm
What
just saying, you
saying
said as an
is, like,
example. I'm just
Yeah,
saying.
like.
Like, there's
it's
only
probably
1
good
day
to
a
have
week
that
worth of work. What are they being paid full time for?
So we would hire another health educator and they would be over like 5 different things.
Right.
But we would take some of the, Trisha and Rebecca and Tia, they're
That are
very
doing double
overworked.
duty right now,
Yeah.
triple duty.
Right.
Yeah.
And so to do all the partnership and coalition building and then actually go out and do stuff, they're way overworked.
So I guess keep itemizing what they do and how much time they involve themselves in those activities per week. So then when they come, there does come a time that you want to hire a full-time person to do some of that, that you'll know that, okay, I know there's going to be 16 hours a week that's going to be dedicated to this specific thing and 20 hours a week dedicated to this specific thing. And then it's a whole lot easier for us to approve something like that. You know what I mean? That you've done the due diligence to show that, yeah, this has to be a full-time position for this job.
Right. And some of that's already done because some of their stuff is paid through grants, so they have to code that already.
Right. Okay.
But once we turn it in and we get input back from the state, we will share more information with you.
Okay, so you want us to approve the 2 positions, what you're saying?
That would be my
Do you have
request
a
for now.
little, do you have a
Yes,
little
I've
thing you
got
want
it.
us to say?
Yeah.
I move to authorize the director to add an environmental public health supervisor and a community health development specialist to the Platte County Health Department table of organization.
And if you'd read the rest of it.
Oh, and make appropriate office purchases for housing these new positions and fill the positions as soon as possible.
Do we have a second?
Second.
Now, I do have one thing I just want to add to the discussion is, do you have a projected salary for each position? Do we know what they would be paid?
Off the top of my head, I do not. I know that the supervisor will be the same pay scale as our current health ed supervisor. Do you know what pay scale that is?
It's 12.
We can get that for you, but it'll be a supervisory position, so it'll be the same as our health education supervisor.
And it's the salary plus all the benefits too, so we can
Right.
keep that in mind.
I think he wants to know.
Yeah. With benefits, all that
Right.
stuff, right? Like with the end of year cost.
Because that's the other thing too, if they want us to hire 19 people, I mean, that's not just a simple feat. We hire
No,
19.
Well,
That's it,
That's a
utopia.
huge chunk of money.
That's
We'll
right.
be getting a request like that.
I don't know that we're there.
So-
The hope is that they're gonna offer some more grants and more funding. I
Yeah.
don't know that that's actually gonna happen, but that's why I hope that they're doing this. Or just, I think they're trying to just look at what the need is, and like, there's definitely some tiny health departments that have a need, but they have a lot smaller populations too, so.
I can
So
see that
it'll be
sharing.
for the
Yeah,
public health
counties.
supervisors or environmental public health supervisor, it'll be around 57
57 plus benefits.
plus benefits. So that'll be roughly around 90.
Okay, and then the community health.
Then the health educator will be uh, around 50. It will depend on their qualifications and experience.
So 90,000 and maybe 75,000 total.
Yeah, so it'll be about 170.
Okay, that's still a lot of money. Just keep that in mind.
It is,
Yeah.
but you won't be getting a request for 19.
All right,
Yeah.
ready to vote? Everybody got their discussion done?
Yes.
Okay, Kim,
Yes.
Susan,
Yes.
me, yes, Zach.
Yes.
Okay.
Your turn.
Okay, so each year we do offer a lot of free flu vaccines to our residents, basically any community member out there. Years past, we usually do at least 2 different major drive-through clinics. One usually in Riverside. Traditionally, we used to do it up in Platte City at the middle school. They are now in school on Columbus Day, so we don't get to do that. Instead, we'll be offering one here. So we proposed that we would like to have a request for 500 doses of flu vaccine to be able to give out to the public just to help prevent disease and make it accessible for anyone without the hassle of trying to go through insurances and getting all that to be able to do a lot of these vast events. Below is like the costs that we currently are projecting. It didn't really change much from last year, so we didn't recommend changing the price any.
Did we use up all the doses from last year when we did it before?
All but like 23.
So it was pretty close.
So it's very close.
And we think we're gonna shoot for about the same number.
I'm shooting for it, yeah.
I'm hopeful we do better because we are wanting to do like at Harvesters, do free flu shots as people go through.
Oh,
So
yeah.
we're pretty excited about
Yeah,
that
that's-
possibility. That seemed like something like people just waiting in line. Oh, I can just get it right now and everyone in the car can get it. And I thought that was pretty ingenious.
And this would
whoever
be
thought
for
that up.
anybody in Pike County.
So the flu ball, is that like subsidized by somebody? Why is it so much cheaper, half the price?
So the flu block is mainly, it's got like 3 times the antigen of like the standard flu vaccine, like flu ball. So that's why that one's much more expensive. And the flu zone, it's 4 times the antigen as the standard flu vaccine. So that's why there's a big price discrepancy between those different vaccines. Most of those like flu ball, Fluorix, they're pretty much standard.
So how do you know which numbers to order for which group?
I track it each year depending on how
Based on
many,
history.
based on age and what was requested, and kind of try to gauge it based upon that. With the flu zone, we usually have that for 65 and older, so most of the people have like their insurances or Medicare will help cover them. We do try to make it a little bit easier with the flu ball, just for general for most population who don't always like. Usually, if you're 65 and older, like they're higher risk for flu, so there's no like deterrent for them to go and get their flu vaccine. It's everyone else we're kind of worried about and trying to get them. Most adults like age 25 to 55 usually are less likely to get their flu shot, so trying to target them and make it easy for them, like driving by after work, you see this free flu clinic, or you're coming here picking up your free food from Harvesters. Perfect time to get them to capture them.
When do you think those will be made available to us?
We actually have it available right now. So as this gets approved, we can set the food prices and start administering them on Monday. Correct, Cindy?
So the 500 free doses would just be for Platte County citizens only, because you have a lot of the folks that come through your food pantry.
Harvesters.
Yeah, that aren't Platte County residents, or are you just,
We can offer it to anyone.
Okay. I didn't know that's, okay,
I see how it worded in there. Yeah.
yeah.
So that
But let's just make sure it's more towards the Platte County, because they can go to their own counties. We're spending taxpayer money, if we can.
Yeah.
Just saying, I agree with you.
Can we
Okay,
make that
Well, we have another memo that we're going to be running by the board tonight. And it is intentionally not serving just Platte County citizens. It's regarding STIs. And it really is because there's no these invisible lines
No. I
of spreading
understand.
disease, if they're in the area. So like for STIs, we're really concerned, like if they're here and they walk in this door and they're hanging out in Platte County, we really want them treated and tested so they're not spreading it in Platte County. I kind of feel the same way about flu, but I will defer to the board.
Do you think we'd use up the 500 doses if we only gave it to Platte County residents?
You know, in the past, we have given it to everybody, right?
Yeah, especially when it comes to the drive-through clinics, we should just, we
So we
know
wouldn't
like
be able to
where
do
the
it.
residents are, we just.
Yeah,
give it to
it's fine. I
anyone,
just
so.
curious. I just, the way I'm reading this for Platte County citizens, that's why.
So, no, that's, I mean, I didn't notice that, I just copy and paste last year, so just updated the.
I
the
think
year.
if we
So we'll
look
just say
through,
citizens.
the far majority is Platte County citizens.
Yeah.
There's no doubt about that. It's just, we have not had a hard stop of checking residency and turning people away. And that's kind of the public health person in me thinking, you know, they're with their mom.
Right.
Who lives in Platte County and they're with them every month when they come through here and they're with them all the time throughout the week. We're kind of doing a disservice if we don't get that person.
And we always think that too, like, you know, people work in different counties, like, so I know we did our big TV investigation a couple of years ago, it was because of people who lived in Kansas, but were working in a big factory at Riverside that impacted all sorts of people throughout the whole metro area, so. That's
Yeah,
kind
I
of
know
why.
there's no magic lines in it.
Yeah.
I get that,
Yeah,
but I'm just reading what this says. That's all.
I like hassle free, so if it could be for everyone, that would make it.
Yeah, right.
All right, so I move to authorize the director to set the fees of flu vaccination as presented and to purchase 500 doses of flu vaccine for distribution to Platte County citizens at no cost.
I'll second it. Can you,
so.
Yeah, I think we
did
just wanna say
amend
citizens.
that?
yeah, amend it to say citizens.
Yeah. Okay.
Distribution of citizens at no cost. Yeah. Yes, you have to say it.
Yeah, so, all right, so starting over. Make a motion to authorize the director to set the fees for flu vaccination as presented and to purchase 500 doses of flu vaccine for distribution to citizens in the area at no cost.
Okay, I'll second. Any further discussion? Kim,
Yes.
Susan,
Yes.
me, yes, Zach?
Yes.
All right, in the spirit of preventing disease, I think last month, Dr. Kingsley, you did question us about some of our STI services and like what the affordability of that is. So we took a hard look at that and started looking at some of what our community partners were doing to try to get a good sense of what was going on. On the first table there, you can see that Kansas City does offer free testing and treatment for any citizen. Doesn't matter like if they're Clay County, Cass County, Kansas City, Johnson, Jackson, whatever. They'll treat and test anyone for free. Clay County typically will do theirs for their citizens on Tuesdays, or if you're a student, whether you're in high school or college, they'll give you free testing based on that, or a flat fee of $25. Jackson, Buchanan have like a set fee, but they only test you if you're meeting the criteria for state, which is usually you have to be symptomatic or a specific age and specific risk factors in order to qualify for that. Ours, we usually do our free testing Fridays as well as we charge per test. So if you get every single test done, it could cost you up to $92. So we're looking at some of the data from it as well. And as you can see there, most of our testing, it's almost a 50-50 split between coming in Monday through Thursday or Friday alone. So a lot of our citizens seem to be liking the free testing Friday and capitalizing on that. Looking at the total revenue we've had from it, where it's about $12,000 annually, so it's a pretty negligible amount for what this would cost us. So our recommendation is to try to, our request is to be able to provide free STI testing and treatment for any citizens, regardless of county.
Okay, so slow down, let me figure this out. So if you come on Monday through Thursday, they do pay
They pay
up to 92 or whatever specific test that they want.
up to $92.
So how do they know what to order them when you come in?
We have a checklist that shows like what each test is, and then how much each test costs. And we usually do sit down interviews with each patient and kind of discuss like what's going on and make recommendations based on that. based on symptoms or like different risk factors and various different things.
You just have to assume they have everything. $92 is a lot of money.
That's just like the maximum. That's like that's like the worst case scenario because we do offer like chlamydia and gonorrhea testing in all 3 orifices is where you can test for it. So we've had patients occasionally who will do that, but it's very, very extremely rare. Most of them just get like the standard gonorrhea and chlamydia, so about $35 per person.
So when they get these tests, what's the turnaround time to get the results?
Usually within 24, 48 hours. So
All the tests, all the whole shebang.
yep, they come back pretty fast.
In Kansas City and Clay County, they do the exact same test.
They have, I think the biggest difference, they do have the provider over at Kansas City Department, so they are able to test for trip, as well as they do offer like monkeypox vaccination there.
So what would be the scenario that you would charge somebody $92?
Like if they were coming in, they would get gonorrhea, chlamydia, and all 3 orifices, testing those, and then getting the herpes testing, and then paying for their HIV and syphilis as well.
Does that happen?
No.
So do they not do it because they don't want to pay the $92, or we just don't even charge them $92?
No, they're just not getting tested in all 3.
So there's actually incentive not to be fully tested. Yeah, that's not good. Right? Am I reading that right?
Yeah, I mean they came like it depends like I said, risk factors too, because like not everyone's having like anal sex or things like that. So sure, it kind of varies.
It's based on their assessment.
And you're assessing symptoms.
Yep. Symptoms, risk factors, there's the big things we look at there.
Well, guys, it's pretty easy to figure out there's something wrong, but women, that stuff can bake for quite a long time before they start having symptoms. So I don't know. It just seems like $92 is a disincentive to have the full testing if they need it. I'm not about, let's just throw away $92. I'm not like that, but I'm just saying that this makes it look like we don't want you to get the full testing because you're going to pay through the blood for it.
Well, I guess what we're saying is we don't want to charge anybody.
Right,
Yeah,
they want
we
to
wanna
do
make
it
it-
free every
yeah.
day.
And we do it for free on Friday.
Yeah, and I think you see that we have 105 of our patients we've had last year were all coming in on Friday, and 117 came in on Monday through Thursday.
How much money we lose on Friday then?
To make about 12K annually, it's probably about 6,000.
So if we did the whole week free, we would lose 12,000, give or take.
Roughly.
Yeah.
But it's going to be more, is my
Once they-
guess.
Yeah.
When
Because
they know
then
it's
we are-
free.
It's free all the time.
So part of the thing with Fridays
Testing, right.
is we can only see a certain number of people, right? So
Mhm.
they have to make an appointment.
Yep.
If we have every day open with appointments, and this is part of the plan also, because we have staff now that have no involvement with the primary health care
Okay.
clinic. So they have more availability to do public health nursing kind of things. We actually, if we start spending $70,000, we may need to look
We
at
might have to review, yeah.
And say like, okay, well,
So,
And if the word gets out that it's free, and then everybody
so
starts
you
showing
don't,
up.
there's
Jack
no
and Jill are
walk-ins, it's
coming
always
in
by
every
appointment.
day of the week. and-
currently,
right now.
but we are wanting to change that
2
too.
walk-ins.
I mean, I think it would be great to have a walk-in clinic at least an afternoon or whatever, so people knew, and I think, we'll have to discuss what day of the week that is with test results and stuff, so we don't get too buried.
Cindy, what's your opinion on this? I'm curious. What do you think? So the whole week free?
Yeah.
And then reevaluate
Maybe
what
we
in
need to
6
reevaluate.
months?
Yeah. And like one of the benefits of it too is we're talking about that school. If it was free for anyone, then we could easily go to offsite clinics and like host those and like capture a larger group of people and be able to do that without like the restraints of trying to bring a clerk in there, collecting money.
Okay.
Yeah. Most of those outside not collecting money.
I think it'd be important. to pay
Friday,
attention
the only
to-
other thing is Fridays are currently our Platte County, so. Fridays.
Yeah, I think it'd be important to like keep track of numbers as far as when we look at it again, because I do think it's a good idea to look at it again in like 6 months or so and just see what's going on there. But keeping track of, you know, one-time occurrences, people coming frequently, like having repeat testing, things like that. Having an idea of whether or not it's like just possibly being abused at some point too.
So let's say the
Saying
testing,
that we make it all free.
let's say the testing's positive, what do we do then?
We get them connected with treatment. So we do treat for gonorrhea, chlamydia, as well as syphilis, HIV. That we refer them to KC Care, and they'll help manage that and get them their treatment. Hep C, we refer them to like provider as well, and then help them getting their.
And we do that for their partners too.
Yep. So partners get to come in, they get free treatment, and they get free testing as well.
And the state pays for that.
Yeah.
Okay.
They don't pay for the testing, but they'll pay for the.
All right.
Treatment.
As long as you guys don't feel like you're gonna be overwhelmed, because once they get the word out that it's,
Well, we've got that
Everything's
extra,
free.
we've got the staff that are gonna be helping in the clinic, so.
so, I mean, that's fine with, like I said, the $92 seems like a disincentive to be fully tested. Yeah, but I don't want people to take advantage of it either, so we gotta.
Well,
be
that's
careful.
why we'll just keep our eye on it.
Yeah,
Yeah.
and I think that'll be that part where we trace track it as far as like, you know, somebody coming like once a week, basically getting testing, if that's the case, you know, if it's like, we see a large number of people doing that, we can reevaluate that, because there could be reasons to do that if you're using like IV drugs, sex work, stuff like that, I think, where it'd be, you know, behoove the people in the county to continue to test those folks, but.
So we do counseling?
We can probably connect them with the Beacon Health if they would qualify. We don't do a lot of counseling. A lot of it, especially with like HIV, state usually manages that, and they have Casey Care take care of most of that as well.
But like for his scenario, let's say it is sex work or whatever, they come in once a week, that we could talk to them and just say, hey, do we need to provide more services for you, or tell us what is it that you need from us or whatever?
It's something we look into. We do all refer, like I said, refer a lot of people out for like sexual abuse and different things like that. Get them connected and ask if those resources. It's not our questionnaire whenever they sign in, and then we have signs in the room as well to kind of connect them to that different stuff and help them out that way. We always look at other alternative options as well too.
Okay, who wants to make that motion?
I'll move to approve eliminating the fees for STI testing and treatment from the PCHD schedule of fees and to be reevaluated in 6 months.
So make sure that's put on the agenda in 6 months. Second, I'll second. There you go.
And
Okay.
Dustin's writing it down, so we can make sure we revisit this in March too.
Okay, any further discussion? Okay, Kim?
Yes.
Susan?
Yes.
Me, yes, Zach?
Yes.
Okay.
Okay, the WIC services contract. So this is for nutrition services with the Department of Health and Senior Services for the period of October 1st through September 30th of 2025. Essentially, this is where a lot of funding for WIC comes each year. The total contract amount is about $369,000, which is about close to $20,000 more than the previous year. As you can see, it covers about 75% of the cost for the WIC program. We're looking for authorization for the director to sign the contract.
Yeah, I'll make a motion to authorize the director to sign the WIC Local Agency Nutrition Services contract with Missouri Department of Health and Senior Services for the period of October 1st, 2024 through September 30th, 2025.
Okay, second it. Any further discussion? Thoughts, concerns? Kim?
Yes.
Susan?
Yes.
Me, yes, Zach?
Yes.
So I think the last piece of new business is Dr. Phyllis Parker, who is our medical director, made a request to me to lease one of our clinic exam rooms. As you know, I've said it like 12 times during this meeting, but family healthcare, we are no longer doing anything there, and Swope will be taking over on October 1st. Dr. Parker, one of her parts of her service with us was seeing patients in the family health care clinic. So she's no longer doing that. So that actually was very nice when she was here, at least every other week, because as medical director, our staff got to rub elbows with her and talk to her and ask her questions. If we had a challenging TB case or an STI case, we could ask her, and it was just more convenient and better communication than calling or emailing. She responds to those, but it was just very nice to have her around. Well, she is starting to do exams on veterans for their ability to get benefits, and she needs a place to do those exams. She asked if we would be interested in renting her one of the exam rooms. She said she would carry her own malpractice insurance. She wouldn't use any supplies or services from us. She just needs one of our exam rooms to do the work. Ran it by Jen Snyder, our attorney, to make sure there wouldn't be any statutory conflicts or any issues. She said she had no issue with that, but did suggest we put it in a lease agreement. One of my criteria, if we did enter into an agreement like this, would be that if she quit being our medical director, the lease ends. I don't want to have an outside person, but I really see a lot of advantage to, she said she'd probably be here about 2 days a week, so actually more than what she's here current or was here. And so we'd be able to have her in the building quite a bit. The other thing is I would like the amount of the lease to come off of her pay instead of her paying us that money. Independence Health Department, which was where I was also director, they put out a bid last year for medical director services, and it was $25,000 a year, and that was no on-site services. That was for reviewing the standing orders and doing just the typical medical director things as needed. So we're kind of getting a good deal already. And then to have her here 2 days a week. I know, Dustin, do you want to say anything about
Yeah, I mean,
whether, how you feel about that?
I'm all for that. Like I think you work with her, you know, she's a wonderful person and just probably one of the smartest people you'll meet. But having her there to help us, like I said, we have any tough cases or trying to find like the right treatment or care for a patient. And then the standing orders, like it's a lot easier to have her like a physical copy just to hand to her and have her sign right then and there than trying to coordinate through emails and things like that. So yeah, to me, I see nothing but benefit, and I don't see it having any negative impact on using that clinic space.
And she's a private contractor. She's not actually affiliated with the VA, correct?
Correct.
My question is, so so she's not doing these exams currently, correct?
Correct.
Okay. So my little issue with this is that she's getting paid from the VA to do this, and she's employed here. But also the fact that, you know, if we're renting out our space, who's to say that another employee would like to rent out a room too at some point in time for another? It sets a precedence, that's what I'm saying, for future situation that, well, okay, she's doing it, so now this person also would like to start a clinic, and I understand that this may be helpful, and I understand your point with having her here, but that sets a precedence of now we're going to have this person in a room renting space, and I just feel it's a little dicey to me. That's where I stand on it.
And she wouldn't actually be an employee of us at that point, right? She'd
No.
just be a private contractor, outside person coming in, providing services, right?
Right. But I mean, has a relationship with us, but
isn't.
yes, for that service, she is not,
But are we
Yeah.
paying her for anything else?
we're paying her to be medical
Medical
director.
Yeah, so I
See,
see it
I-
does
just,
kind of,
that's my problem with it. I think it's, I don't know.
is she not able to do the same service at the VA?
She just,
No, she would have to, like, she has to have her own space.
So what would be so say another employee of the department wants to, they do some side gigs as a masseuse, right? And they say they want to lease out one of our rooms so that they can do some massages and stuff on the side once a week, right? So what would be our grounds for saying like, no, we can't allow that here? You know, like we're not going to, that's not going to be part of the health department's gig here. You know what I'm saying? Like, just kind of,
yeah,
I couldn't
or
draw
I
a true
work for,
delineation. Tell them like, no, you can't do that here compared to somebody doing medical exams for the VA.
I work, or I want to bring in, I work with another government agency and I want to bring in people and see them get paid by that agency. That's where I'm going with this. I just see a conflict there. I feel it's not,
it's almost like what you're saying is that she should get her own office space in another place and do that services,
I-
like everybody else would.
right, so, you know, that's my problem with it.
And I understand, and I don't think she was trying to, I think find some individual space that would be economical, but I also think she was trying to figure out something that would be helpful to us.
Yes,
And
right.
that's what
I
my focus
understand.
is on,
I
was
get it.
the advantage to it, but I also understand ultimately, you know, we could put together some kind of policy for it, but you know, doing the masseuse thing, I don't see any advantage to the health department for that. So I would tend to say no. The whole advantage is
It does
having
have
our
a point.
medical
Once
director.
you make the precedent, you made it too.
Yeah.
Because what do you do then?
I can't imagine there wouldn't be some kind of legal liability. I mean, I think you could easily make an argument that providing massage services would fall under like
Mental
healthcare
health
in
or
certain
healthcare.
areas where,
Or,
you know, I think it would be difficult at that point. If
Let's
they were
let's say you wanted a space and you wanted to sell health pamphlets about something else.
Oh, that's the next memo.
But you see, they have a point. I didn't even think of it that way. Otherwise, other people should be able to do the same thing. It's only fair.
that's,
Now, being on the other side of it, would it be something that if we did have a policy, since we're kind of looking at staff utilizing her services as well for other things that they would need her, that stated that it had to be approved by the board before anyone could do that, or we, well, I guess still.
I mean,
I
Same.
don't have a
now
precedent.
that Kim brought up the thing is, how does the board decide without being discriminatory?
Yeah, that's true, and then we
Because
could get into
is it
legal.
because Dr. Parker's a woman and this other person's a man, or whatever?
I mean, you could make an arrangement with a certain, you know, what she's doing is a great thing. I'm not negative about anything that she's doing. It's just where we're at. You then have maybe the nurse practitioner that used to work here and she would like to do exams for children, separate, I don't know what, you know, mental health, you know, and
Sure.
she's going to be paid by a different government entity. And I
She
mean,
wants to lease space.
So,
it's just not service we've ever provided here. Is this what we're gonna do?
Like if I wanted to do something like that, I would have to go get my own medical office space, pay the rent, all that kind of stuff. I wouldn't come to you and say, hey, you got a spot.
so, and she understands, and I wrote this in the positive way,
Mhm.
but I hadn't, like, I don't really have, besides bringing, I felt like I needed to bring it to the board.
The
She
problem
is
is,
fine with it either way.
Right.
So I just needed an
She's
answer.
still gonna be our medical director.
Right,
so
But will she not be here though? Is she like on call
Right.
as our medical director?
what she wants to do is pretty noble. That's the problem. But
Yeah.
that doesn't mean the next person doesn't want to do something that's not normal, but then you're like, well, you did it before, why can't I do it?
I saw some concern, which is why I took it to our attorney. He didn't have any legal concern with it,
Yeah.
but I am perfectly fine with this direction too. I had to put it somehow so you guys can vote on it. So it would help me if we went ahead and did the motion, seconded it, and then said no. That way we can move on.
And she's not gonna take it personal. She
No.
understands. Okay.
She's already told me.
Okay.
She does want to know what the board is going to decide.
Mm-hmm.
And so,
It just sets us up for a precedence going forward. That would be an issue. I agree with Kim.
I wonder if, our attorney would have anything, cause I'm sure, you know, the attorney more so is just looking at it like liability standpoint, having patients coming in from that lease perspective and carrying your own malpractice insurance, stuff like that to cover things. From that aspect, not having any kind of liabilities or legal concerns, but then from more of a alternative, like another employee wanting to lease and us saying no, if there's any risk for us from the health department standpoint of like, okay, well, now we're saying no to this person, we're saying yes to this person. Like, do we have solid foundation for like, these are the things that we'll say yes to, but these are the things we would say no to, that kind of thing.
so I think we
That can
do
get-
have some liability. And then the other thing is
Yeah.
just someone driving into our parking lot and walking down our sidewalk
Mhm.
brings us liability.
Yeah,
So,
that's why I was wondering how they get to the room, if that's,
so I am perfectly fine
With the, okay.
with this.
Okay.
This was not, this is something I had to kind of put together this way so I could get an answer.
yeah, I think all of us would like to say yes and be like, oh yeah, this sounds great,
I
like.
know.
I
I think all of us want to
I
do
think
that,
this,
but we're all kind of
this is
like,
a noble thing. I
we
think
see
it's
other
wonderful.
problems.
And
It's
I-
just the,
But for this instance,
I
and
Yeah.
I think,
treat these people every day in my job and I want them to get what they need. But in this situation, I'm not working
Yeah,
there.
I don't want the Black County taxpayers to wind up paying for it down the road in a big way if there's some kind of liability issue.
Okay, so I'll make the motion, to move to have the director coordinate and approve the lease of one exam room to Dr. Phyllis Parker, PCHD medical director for the site, sole purpose, conducting, DBQs, I guess, and assessments.
but we don't want to do that.
But no, we want a second and then we're gonna say all no.
Oh, okay.
So we have a second?
Second,
Okay, any further discussion? Kim,
No,
Susan,
No,
me, no,
no,
Zach is, okay, there you go. Like I said, tell her no hard feelings. It's not like we don't think it's,
Yeah.
what she's trying to do. is good.
so Kim's point just really resonated after she said it. And I don't know that I didn't feel that way, but she really brought it to the surface, so.
I
Kicking,
did.
kicking butt, taking names.
And I think Dustin and I's thing was just, we were looking at what the advantage would be.
Yeah.
And it's noble. It's like, if
It's
it's a
very
good
noble,
thing.
yes.
it sounds
But,
great.
yeah, it can be used against us down the road.
Yeah.
Like, I think
No
we're thinking
good
of
deed
this, like,
goes unpunished.
Yes.
like we're already on slow.
and that's a very special population of people that you work with there.
I feel
In
as
a lot of ways.
nurses understand like exactly how convenient it is to have that person right there at the time too.
Yeah.
Yes,
So
Sounds
I
good,
feel like
3
I
a.m.
feel
phone call.
I completely agree with you.
Okay, so the next section is public comments. We don't have anybody from the public. What else are we missing? Is that
Next meeting, October 17th.
Okay, yeah, so the next meeting is October 17th, 2024, 6 P.M.
3
Three
But it's gonna be at 3
3
P.M. because we're
p.m.
changing it. Yes, at Platte County Health Department.
Yeah.
Okay, do we have a motion at the meeting?
And move to end the meeting.
I'll second it. Any further discussion? Okay, Kim,
Yes.
Susan,
Yes.
me, yes. Zach?
Yes.
Okay, thank you, everybody.
No, I think it was.
It's just.
Oh,
to
we do
get
have
one.
to, yeah.
We need to sign all those papers.
Okay.
Pass it around.
Okay, yeah.
I signed, well, we're not signing the new policy, right? Or about, until that's corrected, all the typos are corrected.
You can sign the back page.
Okay,
Because I don't
You
think
are-
anything
okay.
that,
Okay.
The reimbursement check, who has to sign that for me, for the national trip?
Does he have a check?
It's in there.
Yes,
It's signed.
yes,
Sign,
it's signed.
okay, all right.
He wanted to sign
Yeah,
his own, I had to tell
I
him.
asked, can I just sign? No, it's
Did
inappropriate.
you turn off the recording?
Okay, so
Yes.
here. Start the counseling.
Yeah, I need a pen. I don't. I'm stupid. What am I signing?
That's for the policy we discussed, which is a little bit